So, healthcare. Now look, this Senate Republican healthcare bill, I haven't talked a lot about it simply because I'm Canadian and I don't have to deal with this shit. The whole debate you guys are having about protecting just the whole debate you're having about protecting an insurance-based private healthcare system is insane. Now, I get it from your perspective, it's not insane. If I was in your shoes, I would also be trying to protect what little healthcare I have. But you have to understand, the rest of the world is way past you. There are reasons why once countries switch to a universal healthcare plan, they don't switch back. Do you notice that? Isn't that weird to you? If you're on the side that private insurance is the way to go, then why are all these developed countries using or have a universal healthcare system and not going back to a private-only system? There's a reason for that. Because universal healthcare, public-funded healthcare, works. It not only makes more sense and covers everyone, it's also cheaper. So I'm going to get to clips of John Kasich talking about how he doesn't agree with this Republican healthcare plan. And it's from the perspective of John Kasich. And I mean, the reason I want to show you this clip is that even Republicans, when they're not forced to have to vote on this, which John Kasich is governor, so he doesn't have to, then they're more free to speak openly about how they actually feel. But even John Kasich, I mean, he doesn't go far enough on his criticisms of this healthcare plan. But a lot of it is because, look, you guys are in a bubble. You're all in a bubble. You're living in this world where your entire life you've had to think about private healthcare insurance. I've never had to think about that. The one area where we don't have public funded healthcare is with dental care. And I mean, I guess there could be a debate as to whether we should have that publicly funded or not. But it's the one area, look, because I don't have a dental plan, I don't go to the dentist. And I probably should, but it's expensive. And this is the same issue that Americans have with healthcare. If the real point of healthcare is to not get you sick, like a focus on preventative healthcare and not just reactionary healthcare, then universal healthcare is the only way to go. Because when you know you can go to the doctor and not have to pay for it out of pocket, then you go more often and you prevent yourself from getting sick. And when everybody is paying into it with their taxes, the only people that may end up paying more are the rich, the richest people. The people that have their money sitting in a bank anyways. The ones that can afford to pay a little more. So for you not to move to a Medicare for all system, to me, is insane. Now that I'm done this rant of mine, I'm going to go to John Kasich and play a couple of these clips of him on CNN this weekend, of him pretty much bashing the Trump healthcare plan and why he doesn't think Republicans should vote for it.
Do you think that Senator Portman of Ohio should vote no?
Well, I don't think the bill's adequate now. And unless it gets fixed, I'm against it. Yeah. My job is to look not just today, but in the out years at the impact it's going to have on people who need help. Let's not rush something through. Let's have transparency. Let's have some cooperation between the parties, because if you don't, this bill's not sustainable. So I'm not saying just kill the bill. Let's get something that's going to work, that's going to create a stabilizing all these issues around insurance and coverage, and then get to the heart of the matter, which is the rising cost of health care, frankly, which this bill doesn't begin to even do.
So Kasich there is talking about the need to have transparency between the two parties and what is in this healthcare plan and how it will actually affect people, not just today, but also down the road. Now, Obamacare went through, I believe it was 18 months of negotiation and back and forth before it was finally passed. This Trump care bill has barely been read by anybody, and they're trying to push it through before July 4th. Now, regardless of what you even think of the healthcare bill, that's insane. You shouldn't be pushing something this quickly through without proper debate about what's in it. And now, so John Kasich is taking the right angle here in terms of hey, we need to actually talk about this bill before we vote on it. One of the points he raised at the end there is the rising costs. Now, again, as a Canadian, I don't have to think about this. I literally never think about how am I going to get healthcare or the cost of healthcare. You know how much of a burden that must be for somebody who would be used to paying or used to worrying about health insurance and then moving to a system where they don't have to think about it at all? For me, it's just it's inbred. I've lived in this country my entire life. This is what I know. I can't even imagine what having to worry about private health insurance is like, and the fact that the costs keep rising. And why do they keep rising? I'm sure it has something to do with the fact that it's run by private insurance. The whole point of private companies are to turn a profit. That on that basis alone is why it doesn't make sense for healthcare to be a private insurance-based system. Because there is a profit motive off of sick people. And that's the argument that some, like Bernie Sanders, are making to have a Medicare for all system. So let's get to the second clip. And this clip is more of a criticism of both parties.
Both parties ought to be worried about poor people, because I don't think either party particularly cares about helping poor people. You look at the rates of poverty, you look at the problems in this country. We have not designed a system to get people work. Everything we're talking about now, getting people healthy, giving them health care, is designed to get them to work. It's designed to give them an opportunity to have a better life. This is not some kind of a welfare system. This is a, look, if you're sick and you're hungry, you don't work. If you're healthy and you're fed, Governor, you can get a job. And we expect people to have one then.
So Kasich makes a great point in that video. But before I even get to that, I want to talk a little bit about how John Kasich, in more recent months, has been criticizing, quote unquote, both parties. He did this also with the town hall that he had with Bernie Sanders. To me, it increasingly sounds like John Kasich wants to be independent. I'm not sure if he will go that way, if he's thinking about that, maybe in terms of a 2020 run or somewhere down the road. But I just want to bring that out there, and just notice when John Kasich's on how he criticizes both parties. But so the point that Kasich makes there, that is, it's just a fantastic point, is healthcare is meant to have people healthy so that you could work. Now, this is, for me, I mean, John Kasich doesn't go this far, but this is the biggest argument for a Medicare for all system. When there is Medicare for all, the real improvements come in preventative healthcare. So when you have people going to the doctor more often, when hey, my whatever feels weird, my heart feels weird, or I'm getting a little fat, or whatever thing that it may be that may seem small at the time, but could grow on to be an actual real issue that needs emergency help. If people go to the doctor sooner, first of all, it's cheaper in the long run because you're not paying for expensive surgery, because you could actually prevent larger issues down the road. But it also means that you have more healthy people going to work. So for a system that is so focused on corporate profits, I just find it kind of weird that there aren't more corporations on board pushing for a Medicare for all system. Because it would mean in the long run, more people at work and working at their full potential.